Jessie. My name is Ashleigh Starnes. I'm a family nurse practitioner student with South University Online. I was just going to do your head-to-toe assessment today. I might be speaking throughout it. A lot of that is for my benefit as well as the benefit of those watching. It also helps you know if there's anything abnormal or what is within normal limits on you as well. I just need you to tell me your name and how old you are, and if you have any questions or concerns for me today.
Jessica Collins. I'm 22 years old. No concerns.
Great. I'm just going to go ahead and put gloves on throughout the entirety of the exam just to protect you and myself. We already did her vital signs before she came into the room. Her height was 5'0". Her weight was 104 pounds, which gives her a BMI of 20.3, which is very normal. Her blood pressure in her left arm was 102/60. Her pulse was 68. Respirations were 16. Temperature 98. O2 stat was 98%. Her Snellen chart result was 20 out of 20. She does not need glasses or contact lenses for correction. I'm just going to take a peek at your skin and assess the color, if there's any abnormalities or lesions. You are very fair-skinned. You do wear sunscreen outside, correct?
Yes.
Every day?
Mm-hmm.
Great. I do note some moles and freckles on both arms. Have you noticed any changes in size or color?
No.
Okay, great. Just going to take a peek at your legs. I see a bruise there and a little cut over here. They both look infection-free and very normal. Just looks like you're a pretty active girl. I'm going to assess and palpate your scalp for lesions or any abnormalities. Have you felt any lesions?
No.
When washing your hair or anything?
No.
Great. No tenderness noted?
No.
Great. You have no lesions noted, and your hair is very fine and thin, but very well distributed. No spots of balding noticed. I'm going to check your temporal pulses bilaterally. Great. Now I'm just going to check your jaw muscles, check for any TMJ tenderness. If you could just open your mouth and close. Open it again and move your chin side to side. Great. No tenderness there?
No.
Perfect. I just need you to wrinkle your forehead. Can you smile? Puff your cheeks for me. Great. And I'm just going to have you, clench your teeth right there. Perfect. Now I'm going to check your senses for sharp and light touch. I'm just going to touch it across 3 different areas on your face as well as a couple places on your arms and legs. So just tell me which one you're feeling, whether it be sharp or light.
Okay. Light. 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 Light.
Great.
Sharp. 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 Sharp.
Great. Now I'm gonna, at this point we would have done your Snellen test, but we already did that outside, which you were 20/20. So now I'm just going to take a peek in your eyes, check the whites of your eyes and your conjunctiva. The whites of your eyes are very white, very normal. Same thing there. I'm just going to take a peek at your conjunctiva. Great, very pink and moist, all normal. Now I'm just going to assess your pupillary response in response to this light, okay? Great. Great. Perla is noted bilaterally. Now I'm just going to do a couple vision screenings with you just to check your peripheral vision. If you could just cover one eye for me, and I'm going to wiggle my finger out to the side and just let me know when you can see it.
Yes. 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 Yes.
Okay, do the same thing with the other eye.
Yes. 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 Yes.
Great. Now for both.
Yes. 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 Yes.
Perfect. Now I just need you to follow my finger with your eyes. Great. You had bilateral eye movements, no nystagmus noted. We already looked at your pupils. If I did have an otoscope, I would want to look into your eye and check the inner structures and the vessels. I do not have that. I would also check for the cornea at that time as well. Now I'm just going to check your hearing. I'm going to go over here on both sides, and I'm going to say a word, and I just need you to tell me when you hear it.
Blue.
Great.
Blue.
Great. Now I'm going to look at your ears on the outside. I don't see any lesions, no abnormalities. You do have 2 piercings on this side. I'm going to check your other side. Great, also 2 piercings. Everything looks normal. I would use the otoscope if I had one to check the inside portion of the ear. I would make sure in an adult that my light is at the 7 o'clock hour. I would just be checking for any redness, any swelling, inflammation, drainage, impacted serum, and anything like that that would lead us to believe any infection, and just make sure the eardrum is intact. I'm going to check in your nose now and check for patency. Great. No trouble breathing?
No.
Wonderful. Now if I also had an otoscope, I would check inside of your nose and check your turbinates and make sure that they are appropriate and open and you're not having any breathing difficulties or any redness. I'm going to check your sense of smell now. I just need you to let me know what you smell.
Alcohol.
Great. I'm going to palpate your frontal and maxillary sinuses to see if you have any tenderness. How about here for your frontal?
No.
Maxillary?
No.
Okay, great. I'm just going to have you open your mouth and stick out your tongue so I can check your tongue for symmetry. Great. No lesions are noted. It is symmetrical. Just going to look into the oral mucosa. It is pink and moist. Her gums are very well hydrated. No lesions or abnormalities noted. Can you just say ah?
Ah.
Great. Her uvula is midline and symmetrical. She does not have tonsils, but if she did, we would want to inspect those for size, any swelling, redness, and white patches, anything that could include us to think of strep throat. Now I'm just going to check your thyroid. I'm going to place my hand on each side. If you could just swallow for me. Great. Symmetrical, no swelling noted, no abnormalities. I'm just going to palpate your head and your spinal lymph nodes right now. No tenderness?
No.
Still good?
Mm-hmm.
Great. Now I'm going to check your range of motion of your neck. I'm just going to have you turn side to side. Make sure that there is no tenderness and no limitations in movement. Pull it back. Great. And to your chest. Perfect. Alright, next we're going to go check your shoulders and upper extremities, okay? I'm just going to start by assessing lymph nodes. No tenderness.
No.
You could just raise this arm for me. Great. Same thing on this side. Great. No tenderness noted.
Nope.
I'm going to have you shrug your shoulders. Great. And now don't let me push your shoulders down. I want you to try and perfect. I'm going to check your elbows on both arms. Check the bones, the lymph nodes. Great. I'm just going to have you bend with that and do the same thing with the other. Great. Do that. Other side. Perfect. Now we're going to check your range of motion with your shoulders. I'm going to bring this arm out. Can you do the same thing with the other? Perfect. I'm just going to raise it forward. Do the same thing. Okay. I'm going to do across. Can you bring it back behind your shoulder? Perfect. I'm just going to have you hold your hands out like this. Okay. Don't let me push them down. Perfect. Do the same thing, palms up. Okay. Don't let me push. and don't let me push. Great. Okay, for this next step, I'm going to assess your lung sounds, your heart sounds. I'm also going to just stand here and assess your breathing now. It is symmetrical in easy rise and fall. Great. I'm just going to take a listen. Every time I move my stethoscope, I just need you to take a deep breath in, okay? Good. I'm going to listen back behind you. Great. Lung sounds are clear bilaterally. Bronchiovesicular and vesicular breath sounds are heard where is appropriate. I'm just going to listen to your heart now. I'm going to have to go under here. PMI is heard at the 5th intercostal space, mid-clavicular line. Next, I'm going to inspect your abdomen, check for any scars, striae, any abnormalities, and after I'm done assessing your skin, then I'm going to take a listen. I'm also going to check your carotids, make sure that there are no bruits heard, and make sure that there's no jugular venous distension noted. Okay? Just go ahead and lean back. Okay. I do see 2 surgical scars here from where she had her gallbladder out. They're about 1 centimeter in length. There's another one right here midline. Everything else is without remarkable note. No swelling noted, and no bruising or scars. I'm just going to take a listen. I'm going to check your carotids first. Breathe normal. Great. Perfect. Also going to make sure there is no distension here. None is noted. I'm going to listen to your bowel sounds. Bowel sounds are present and active in all 4 quadrants. Now I'm going to listen for your abdominal aorta. Great. Now I'm just going to percuss and then palpate, okay? No pain?
No.
Great. Take a deep breath in. We do not feel her gallbladder over here because she did have it removed several years ago. Deep breath. The spleen and the liver. Great. While we have her laying, if she did not already have her appendix out, which she did, we would check for the obturator and psoas sign, which would help indicate appendicitis pain. She would, upon those movements of the leg, she would experience tenderness in the right lower quadrant. For this next part, I'm going to be assessing your urinary bladder and any CVA tenderness. Have you had any unusual urinary frequency symptoms like increase in frequency, burning with urination, any blood in your urine?
No.
Great. Okay, I'm just going to come back here. I'm going to check for CVA tenderness. Nothing?
No. No.
Great. The rest of the genital urinary exam is deferred due to privacy reasons. Also, the rectum and anus exam is also referred. Now when we move to the assessment of the hips and the knees, I'm going to have you lay down so we can assess for any edema, any tenderness. Just going to check some of the prominences here. Everything is normal. No tenderness upon palpation?
No.
Great. Now I'm going to check the hip rotator motion. I'm just going to have you bring your leg. Great. Can you do the same thing on the other side for me? Perfect. We're going to have you kind of wing out your leg as far as you can. No pain?
No.
Can you do the same thing on the other side? Great. And now I'm going to have you bring it to the inside of your body as much as you can. Great. No pain there?
No.
Same thing here. Great. Perfect. Now I'm going to be moving to the patella, your knee. I'm going to check for any swelling, any fluid, any tenderness. Okay? No swelling, nothing's tender?
No.
Check under here. Feel your pulse. I can feel that pulse. Now I'm just going to do some range of motion with your knee like we did with your hip. So just have you kind of perfect. Have you internally, externally. Can you just, great. No pain on any of those movements?
No.
Perfect. Now we're going to move to your feet and your ankles. I'm going to assess your ankles and your feet for any swelling, edema, any abnormalities, and we'll do some light and dull pressure again, and then we'll do some range of motion, okay? You don't have any lesions. Great, let me check your pulses. Perfect. Can you just rotate your ankle in for me? Great. Can you bring it out? Same thing. Okay. Can you push down on my feet? Don't let me pull them up. Okay. Can you flex your feet towards yourself? Great. Don't let me push them. Perfect. And now for some feel. Tell me what you feel.
Sharp. 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 Light. Light. Light.
Perfect. Now I'm just going to check your reflexes throughout your body. I do not have my reflex hammer tool, so I'm just going to use my hands for this specific one. We'll do biceps, triceps, brachioradialis. We'll do the patellar and the Achilles. Great. I'm also going to check for Babinski reflex, which you should not have. Great. Perfect. Okay, now I'm going to assess sensation bilaterally. I just need you to tell me if you feel something wet and cold or if you feel a dry cotton ball.
Okay. Wet and cold. Cotton ball. Wet and cold. Cotton ball. Wet and cold. Cotton ball.
Great. Alright, now I'm going to check some rapid movement in your hands. I just want you to take your thumbs and you're going to want to bring your pointer finger, middle finger, ring finger, and pinky in that order and then reverse it. Perfect. For this next part, I'm going to check your coordination and your gait and balance. So I'm going to have you lean back. And if you could just rub the top of your shin with the heel of your foot, both sides. Perfect. Great. All right, now we're going to have you stand up and we're going to assess your gait and your walk. If you could just come over here and just walk normally for me. Perfect. We're going to have you come back, and if you could do toe to heel. Okay. And then if you could walk on your heels if you're able to. Perfect. Okay, so for this last part, we're going to check your spine, make sure it is symmetrical, and that you have no pain in anything with bending and range of motion.
Okay.
So I'm going to get behind you, just bend over and touch your toes. Great. I'm going to have you stand back up, and just have you kind of go to the side. Perfect. And then if you can kind of bend and turn. Great. Now I'm going to have you test for the pronator drift. So what I need you to do is just put the palms of your hands out like this and close your eyes for about 20 seconds. I'll tell you when to stop. 10 seconds left. Perfect, 20 seconds. And they did not drift abnormally. Now I'm going to do the Romberg test, so don't let me push you over or anything. And if you could just flex your back, make sure that your range of motion is great. Perfect. This concludes my head to toe assessment. At this point I would take off my gloves and I would go wash my hands again. Did you have any questions for me about your assessment?
No.
Great. Thank you so much for being my patient today.
You're welcome.